Assalamualaikum. Today's topic of discussion is approach to gum bleeding or skin bruisability. So we will discuss the OD para of both the complaints because it can come one and the other together even. So if a patient comes with presenting complaint of gum bleed for last 1 month, how we are going to proceed with the history of presenting illness? The OD para will be my patient normotensive, normoglycemic, presented with a complaint of gum bleed for last 1 month, which was sudden in onset, progressive, initially staining only the teeth on brushing, but now she is experiencing spontaneous bleed without even staining the teeth and saliva. This gum bleed is relieved temporarily with cold water gargles. However, it is not aggravated by anything, and this is associated with skin bruisability. Along with this OD para, you have at every symptoms in which there are symptom of thrombocytopenia. So you have to rule all the symptoms of pancytopenia. There is no paleness of complexion, or there is paleness of complexion and there is no history of any recurrent infections. So this was OD para for gum bleed. The next is the OD para for skin bruisability. That my patient had skin bruisability for last 1 month, which was gradual in onset, initially localized to the forearms, lateral progressing to the thighs, and it was unilateral or bilateral. It is asymmetrical. Initially was pinpoint, later involving large patches, and it is non-painful. Initially it was red in color, progressing to blue and then purple in color, and this was more with any minor trauma, and this was not relieved by anything. And this how association is what it was associated with any skin, any gum bleed or any bleeding from any other orifice of the body. And the same, that is there is history of paleness of complexion, there is history of any recurrent infection you have to mention in the OD para. Then the second paragraph, as we know, the differential diagnosis to rule out for the skin bruisability and the gum bleed. Then starting from viral infection, the patient has exposure to any mosquito bite, any previous history, a recent history of flu, sore throat, any retroorbital pain, any high grade or low grade fever. There is no history of any bleeding disorder, any use of blood thinning agent, or any history of delayed bleeding after circumcision if he is a male. Then there is no history of any decreased urine output, any blood in urine and generalized body swelling, or any previous episode of dialysis being done, any black or blood in vomitus, or any black tarry stools, any previous any history of recent history of bleeding in stool for HUS. Then for TTP, there is no weakness in any part of the body. If she's a female, no previous recent pregnancy or any recurrent history of abortions, any history of blood transfusions or platelet transfusions, any previous skin rash or skin eczema, and any mechanical valves present. Then for secondary ITP, you can ask all the factors for hepatitis B and C, that there is no blood transfusion, there is no IV drug abuse, high risk sexual behavior, use of shared needles, and for hepatitis B and C. Then for autoimmune, there is no history of any oral ulcers, any foot skin rash on exposure to sunlight, any recurrent abortions, then any decreased weight loss, decreased appetite, any lumps and bumps in the body. Then no history of any yellowish discoloration of sclera. Then heat or cold intolerance, any weight gain or weight loss. Then any use of Hakim medications, steroids, NSAIDs, any antiplatelet medications, anti-epileptic medications, any immunosuppressants, any chemotherapy, and any blood thinning agents like heparin. Then comes the care, which is actually the complications. What can be those are same, that if patient is having gum bleed due to thrombocytopenia, what actually the complications here, that is the bleed. That can be in any form. If patient has can develop any sudden weakness, there can be facial deviation, it can be fits, it can be sudden blindness, irritability, and they can be bleeding from any side, the ear, nose, throat, or there can be blood in urine, blood in sputum, there can be swelling in the joints, and there can be menorrhagia. So you have to ask all these for complications if patient presents with gum bleed or skin bruisability, in order to keep our differential as thrombocytopenia, which can be due to any autoimmune disorder, which can be drug induced, or which can be an ITP. So it was a short note. Thank you so much. Don't forget to subscribe my channel. Thank you.